Hi, my name is MediStop. Welcome to my channel. In this video we will talk about a challenging topic, Behcet's disease. Behcet's disease is a vasculitis. Therefore the blood vessels are affected. It has a multisystemic approach, being responsible for several clinical manifestations, such as oral ulcers, genital ulcerations, ocular and skin disorders and so many others. Behcet's disease, also known as Behcet's syndrome, was first discovered by a Turkish physician before the Second World War. It is not a frequent disorder. The highest prevalence has been reported in Japan, Iran and Turkey. Anywhere else it is not so common. The usual age of diagnosis is between 25 and 30 years old, and it is more frequent among men than women, especially in the Asian countries. Moving forward to the clinical features, this illness is based on Behcet's criteria. The first one is the most important: recurrent oral ulcerations. This sign appears in over 95% of the cases. Any of us can experience mouth ulcers once in a while, but in this case, ulcerations of the oral mucosa are more than 3 episodes per year. These lesions can be spotted anywhere in the mouth, but especially on the tongue, lips and inside the cheeks. They last for 2 to 3 weeks and they are very painful lesions. Genital ulcers. These important manifestations can be less frequent than mouth ulcers. These ulcerations can be found on the scrotum for men and on the vulva for women. Then, there are the ocular clinical features. Uveitis. Generally, the classic form is the anterior uveitis, but it is not infrequent to find posterior uveitis or panuveitis. This is a very serious event, therefore it must be treated as soon as possible, so the patient does not become blind. Other clinical manifestations are the skin lesions, a particular one being erythema nodosum. Usually, it is spotted on the lower limbs. It might be located near an articulation, and this can make you think that it is a type of arthritis, when in reality, it is not. Other skin disorders can be acneiform lesions, which are common among teenagers, but can be pathological if it is present in adults. It does not respond to corticosteroids. For the diagnosis to be complete, oral ulcerations must be present and then, 2 out of the other ones must be positive. These are the main criteria which are very important for the diagnosis. But, Behcet's disease can also have systemic signs and symptoms. Rather common, arthritis can be a clinical manifestation for the patient's articulations. The joints can be swollen, red, and painful, especially in the morning. However, the rheumatoid factor is negative. Being a vasculitis, it provides the blood vessels with a prothrombotic status, which can predispose the patient to ischemic events that can also affect the neurological compartment. Patients with Behcet's syndrome are at risk of having an ischemic stroke. Other risk here is the aneurysm, found especially on the aorta, or the big vessels. This illness also affects the gastrointestinal system. It can cause abdominal pain and diarrhea, and the intestinal mucosa may present ulcers, which can result in melena. As far as the treatment goes, we have a few options. First, we may use corticosteroids. Then we have immunosuppressive agents, like cyclosporin, used especially for uveitis and for the neurological complications. Another drug that we can use is colchicine, which has proven its worth in treating erythema nodosum and joint pain. Finally, we could resort to anti-TNF agents, such as infliximab or adalimumab, in order to treat severe uveitis and gastrointestinal signs. With that being said, here we finish this episode. I hope you enjoyed it, and if you did, hit that subscribe button to never miss more content like this. If you want to know how can kissing make you ill, you should check my video about infectious mononucleosis. I also have a nice video in which I explain how does modafinil work, the nootropic drug that makes you smart within seconds. Check the link in the description, maybe you will like it. Thank you for watching. See you in the next one.